My name is Cynthia Stein. I'm a licensed physical therapist at Concussion in Pittsburgh, Pennsylvania. I specialize in treating patients with post-concussion symptoms and headaches. This video's purpose is to discuss and demonstrate a structural technique for concussion called Nasal Release Technique. I teach this worldwide to physical therapists, chiropractors, physicians, naturopaths, and nurses. I spent the first 7 years of my career as a physical therapist in the U.S. Navy. It was here that I was first introduced to traumatic brain injury or concussion. Unfortunately, at the time, I didn't have the tools to treat this disorder properly. Following this, I opened a physical therapy private practice. In the late 1980s, I saw the need to get a new set of skills, so I began training in craniosacral therapy. Two doctors of osteopathy, Dr. William Sutherland and Dr. John Upledger, are credited with the development of the theory and practice of these techniques. Beginning in 1930, Dr. Sutherland identified specific movements of the bones of the skull. He taught that these subtle movements were necessary for brain health. In the 1970s, Dr. Upledger began researching these techniques, finding evidence that slight movement exists between the cranial sutures. Dr. Upledger founded the Upledger Institute, where I was trained. There are 22 bones in the skull, 8 cranial bones and 14 facial bones. Each of these bones have specific movements. As a whole, the skull subtly expands and contracts in a rhythmic pattern. Along with our respiration and heartbeat, this movement assists in the brain fluid circulation. In other words, the arterial and venous blood, the cerebrospinal fluid, and the lymphatic fluid. The proper flow of all of these fluids is necessary for brain health. When a strong force comes into the head, it disrupts the movement of the cranial bones. Dr. Bennett Amalo, a pathologist who identified chronic traumatic encephalopathy, reports that hits to the head can cause an inflammatory response in the brain, which causes scar tissue formation. This has been seen post-mortem in the brains of NFL football players. The typical medical treatment for concussion involves rest and the avoidance of overstimulation. In my experience, I have found that more needs to be done to address this problem. There are structural techniques that can effectively help. Nasal release technique is a procedure that releases the pressure and force from the head. This has been around since the 1930s. It was taught mostly on the West Coast. Dr. J.R. Stober, a chiropractor and naturopath at Western States Chiropractic College, taught this until he died in the late 1980s. My goal in teaching this to healthcare practitioners is to see it used in concussion care in mainstream medicine. The technique uses a blood pressure bulb with a finger cot attached to it. This is inserted between each of the 3 nasal turbinates, then expanded inside the nose. This creates a mechanical force which moves the bones of the skull. I have found this to be very effective in treating patients who continue to have problems with headaches, dizziness, fogginess, tinnitus, and TMJ pain. It made remarkable changes in my own sinus problems. I have seen symptoms change in my patients, usually after 4 to 10 treatments. There are many people who have not been helped by standard concussion care. In my experience, this is one of the most effective treatments I have found to help concussion. I'm going to demonstrate nasal release technique. I use a blood pressure bulb with a finger cot attached to it. Initially, when I see a new patient, I insert it in between the turbinates and I only do 1 inflation. As the patient comes more, I then add more inflations and I add more balloons to increase the pressure. Nasal release technique involves 8 insertions. I put it in between the lower turbinate, in the middle turbinate, and the superior turbinate. And then I go back down and retreat the lower. That balances things out. The first insertion is in the lower. I do the right and the left. This affects what's called the maxillary and palatine sutures. Those are on the roof of the mouth. The second insertion goes up and in at a 45-degree angle. This affects the zygomatic sutures, or the zygoma bone, which is your cheekbone. The third inflation affects the sphenoid bone, which can be seen on the outside of the head. It is also on the inside of the head, and this is actually where the pituitary sits. It sits on top of the sphenoid. So when we get this very deep bone manipulated or mobilized, it really affects the hormonal system and a lot of things in the body. The last insertion is done up and back. My patient has had this technique done on him numerous times. For the purpose of this video, I'm using 2 balloons on my blood pressure bulb, and I'm going to inflate it 4 times. The first insertion is between the lower and middle hiatus, and that's the insertion that gets the roof of the mouth. He takes a deep breath, and I'm going to inflate it 4 times. I then do the same thing on the left, lower. I have him take a deep breath, and he holds it. 2, 3, 4. I then take it into the middle. That's at a 45-degree angle. I have him take a deep breath and hold, and this gets the cheekbone, or the zygoma sutures. I do the same thing on the left side. He takes a deep breath and holds it. I then do it in the superior, and that's directly back, directly up and back. He takes a deep breath and holds, and that gets, as I said, the sphenoid. Then I take it into the left, directly up and back. He takes a deep breath and holds. And then I balance it out by going back into the lower. He takes a deep breath and holds. And the left side. He takes a deep breath and holds. Can you tell us what you felt from the procedure?
You feel the expansion of the balloon and pressure as well, and then occasionally you experience the cracking of the bones shifting. Hi, my name is Rocco, and I'm 21 years old. I've had 7 concussions dating back to the year 2009, and originally I visited the UPMT concussion clinic, in which they confirmed those concussions with an impact test. But as time went on, my post-concussive symptoms never went away, and I was simply categorized as someone who doesn't get better. I moved on to neuromuscular dentistry, in which we use splint therapy and dentistry to get myself pain-free, but I hit a plateau and things stopped advancing. In May of 2016, I started with Cindy doing her nasal release technique. I noticed immediate reprieve in terms of nasal structure and breathing. After about 5 to 7 treatments later, I found that my headaches had ceased as well, and now it's been around 2 months since I've had a headache. For those of you that are still struggling, I highly recommend nasal release technique.
Concussion is a huge problem in today's society. Over 500,000 head injuries occur in the United States every year. The military has reported that almost 350,000 veterans have suffered from traumatic brain injury since the year 2000. I feel that it is imperative that the effectiveness of this work be researched so that it can help our wounded warriors and anyone else affected by head trauma.